We have Dr. Michelle Spenny with Billings Clinic. She is a dermatologist, and we're going to be talking about skin today, right? We had one question. We'll just get right to it from Patty Knopp. She says, my 12-year-old daughter has bumps on her arms. They're like little zits. We can't seem to get them to go away. Do you have any ideas for that?
Well, it sounds like it might be a condition that we call Keratosis Pilaris, which is a really common condition, typically on the back of the arm. Sometimes you can see it on the thighs, and they do look like little pimples or little rough bumps. It tends to be genetic, which of course means that it's very difficult to treat, and so most people, most children do grow out of it, or at least to some degree. So, and
there's no harm.
No,
it's not harmful or anything.
No,
okay.
It's not.
Okay, and then some other things to talk about. Dermatitis is a contact. Is it a contact condition or something that's common, right? I know you wanted to talk about this morning.
Yeah. So there are many types of dermatitis, but a type that I have a particular interest in is called contact dermatitis.
Okay.
And that type of rash is due to something that's coming into contact with your skin that's creating a dry or itchy rash. There are two main types, irritant and allergic. The irritant type of dermatitis is when your skin is contacted with something that's really harsh, like a soap or a cleanser. So a really common example is a lot of us during flu and cold season will wash our hands frequently, and you get those dry cracks in your hands. The other type is called allergic contact dermatitis, and that's when your skin's coming into contact with something that it's developed an allergy to. So your immune system has become hyperactivated toward that chemical.
That's interesting. So is it something that we could be using for a long time and then all of a sudden we see this and we're saying, oh, this is so strange?
Exactly. That's often how it occurs. So you'll be using a product, your favorite shampoo or something forever. You don't realize that it's part of the problem, but it can develop over time, definitely.
And what are some of the symptoms of that then for people to see that and say, okay, this isn't alarming, but maybe this is something I should get checked out?
Yeah, it usually is itchy, and it's usually persistent in the same types of locations. So you'll have either on your hands, that's the most common, but it could be other body sites like your scalp or your neck or eyelids are pretty common areas as well.
What about laundry soap? Is that a common thing?
You know, laundry soap, because it gets washed out, is not the most common irritant or allergen, although sometimes the fragrance that they put into a laundry detergent can be problematic if it's a residual product, but a lot of times it's really simple, like a fragrance in a shampoo or a conditioner, or your makeup has a preservative in it that you've become sensitized to. It can be really hard to try to eliminate these things on your own. As an example, I had a patient the other day that tried to eliminate a lot of her hair care products. She was getting a rash kind of around the hairline, neck, and eyelids. She spent a lot of money trying to change up her products, eventually started thinking that it was her hair dye, unfortunately, so she was very worried about that. Came in to see us, and we did what's called patch testing, where we can actually look for the allergen, and she was actually found to be allergic to a preservative in her shampoo, so we were able to find an alternative for her, and she uses the new shampoo and she doesn't have to stop dyeing her hair. So
that's good. Actually, my mom has that problem with the dye. I think that's common, and it came later for her too.
Yes.
So it's really interesting. It's good to get the professional help there to separate. Generally, just real quick, would you say fragrances is generally something that's that can be harsh for certain people who are sensitive?
Yes, I think fragrances are pretty common cause of allergy, but it can be something really sneaky, like a preservative too.
Okay.
So,
interesting. Thank you so much,
You're
Dr.
welcome.
Spenny. We loved having you in this
Thank you.
morning. We'll be right back, everybody.